Good morning. Just checking my audio.
We hear you,
Loud
Mark.
and clear.
Wow, I'm so sorry for that, team.
Too loud.
Mark, I missed that, man. Glad to hear you.
Look at his library in the background. Wow, you feel like a really intelligent guy.
Yeah, it's just it's a fake one, Fred. I just try to.
It's the backdrop. All right, we are good to go. Kevin Freeze was just trying to make sure that we are streaming this video because it's a public meeting, as are all the CCESAB meetings. So for the awareness of this group, this is something that we haven't met for quite some time, but our ability to meet now is all predicated on being able to do it effectively virtually, and then also having a live stream of it to make sure that we are still complying with the public or the open meetings regulations. So with that, why don't we call the meeting to order, and I'll get started with a quick roll call here. Cleveland Emergency Management.
Yep, Fred Zabo's here, Mark.
Hey, Bob Horwath.
Bob. Red Cross.
We're here. Tom Rubelinsky from the DPM. Say hello to everybody. Thank you.
Yeah, thank you so much for being on the call. And I definitely want to, on our new business, let you introduce yourself and tell us a little bit about, your background and hopefully we can do that a little bit later in the meeting so we can learn more about you. But I really appreciate you being with us this morning. COAD. County Board of Health. I know.
Hi, Mark.
Yeah.
It's Heidi, and I think Rebecca's on too.
All right.
Yeah, Rebecca's here.
Thank you. Cleveland Department of Public Health.
Yep. Hi, Tommy Doot here.
Tommy. Megan Cove, Case Western Reserve. And Center for Health Affairs. Okay. If you remember back to last time we were all talking about this and finalizing bylaws, those are actually our official members, voting members. So now we can go and do the regular roll call to everybody else that's on the meeting. So I see Brian, Klaus from our office, and I guess and everybody. For the people that aren't on the actual video, I can just let everybody know that Brian Klaus from our office is on, Lieutenant Patry from CSU, Bob Z from Ohio EMA. I see CSU Dave Diggins is also on. We have our grants folks, Leslie and Larry, and Michelle Sowers from Ohio EMA, and Chief Galgus. Did I miss anybody? Shimon too, Cleveland EMA. Thank you all for being here. I'm just going to give a little quick intro and then we'll get into the agenda. But I really appreciate everybody for being on the call this morning. It's been since February 5th, the last time this group convened, and a lot has changed since then. And some of the other CCESAB meeting or subcommittees have met and are starting to kind of, just acclimate themselves to the new virtual meeting atmosphere. And so I just wanted to make sure that we took at least one more opportunity to convene this group prior to the new year beginning. And so I don't expect this meeting to go very long. I understand, first, everybody's got meetings on top of meetings. And secondly, a lot of us are interacting with some regularity in some of our other forums. So if nothing else, I just wanted this meeting to serve as a quick touch point to let you all know that this group still exists. And I hope that we can actually reestablish, a meeting tempo in the new year with more frequency again. And I also wanted to take the opportunity to let people know that there has been some transition with some of the former members of this group, and some of their replacements are on this call. And we can, like I said a few minutes ago, we can let them sort of introduce themselves. I guess now would be the best time for the awareness of the group. Ben Bellucci has left the Red Cross, who was a one-time member of this of our committee, and so Tom is the new DPM from Northeastern Ohio. And so Tom, would you be able to give us a little bit of a background about yourself? And Tell us who you are, where you're from, and so on.
Oh, I live in Paynesville. Prior to with the Red Cross, I worked with Family Entertainment Group as the Vice President of Operations and Safety, where I was also an amusement ride inspector, and as well as managing the safety and the operations for locations like the Kalahari and the Great Wolf Lodges. And unfortunately, due to COVID, I lost that job, and I was fortunate enough to get this one. I was also a long-time volunteer with the Red Cross doing dad calls. Also, previously, I was in the Army as a captain in the Army. I did a tour in Germany and also as a peacekeeper in the Middle East. So,
Thank you very much.
Welcome to be part of, and I just want to let everybody know that the Red Cross, we just instituted new software to manage our dad calls. It's called RC Cares. It's more tablet friendly and flexible. So it rolled out this week, and we're just working out a few bugs, but it'll give us a lot more flexibility and a lot more ability to provide better service to our customers. To the clients. We'll also be able to do electric fund transfers, and it really enable us to do a truly virtual response. The only thing asked with the different fire departments, if we could get a little really good assistance detailing the damage that occurs at any fire, so that we're able to better serve the client. So.
All right. I appreciate that. Appreciate you again being here as part of this group. And I can, I'm sure Rick has shared some background about the county's emergency advisory committee. This is one functional subcommittee of that group, that larger group. And I can definitely share more information with you offline about that, just so you're, brought up to speed on the intention of that, that advisory committee, and then obviously our little, our own little vision and objectives within this group. So again, I appreciate it. Mark Oka, I think I skipped over you when I did the roll call, and that's so I apologize. You're our hospital emergency management rep. It's been a while. Sorry about that.
No worries.
Another transition.
But Mark, to that point, and maybe to help Tom here, maybe we should all introduce ourselves and our agency so he gets a similar courtesy.
Sure. Absolutely. That's a great idea.
Tom Matakoka, I'm with Metro Health System. Have been doing emergency management for 10 plus years, and Life Flight before that, and probably something else before that too. So welcome to the team.
We can just go down the screen. I guess let's see, Fred. Why don't you want to go next, Fred?
Good morning, Fred Zabel, Emergency Manager for City of Cleveland, Office of Emergency Management. I'm a real fossil, been with the city for 48 years now and enjoying every minute of it, and a good friend of Mark's, and not many people say that. No, I mean Mark from Health, not you, Mark.
Okay. Perfect. Kevin?
I'm Kevin Fries. I'm the Planning, Training, and Outreach Manager for the County Office of Emergency Management. And before this, I was a hospital emergency manager for the Cleveland Clinic, and before that, Chief of EMS in New Jersey.
Thanks, Kevin. Ryan, how about you?
Morning, Brian Kloss, County EOC Manager. Just a guy that likes to get stuff done.
Lieutenant Petrie?
Good morning. Beverly Petrie, Police Lieutenant at Cleveland State University. Been with the university for 15 years. I oversee the emergency management functions here at the university. And I work closely with my colleague, David Diggins, who is also, he's with the EHS department, and he'll introduce himself. But welcome to the team. Look forward to working with you.
Thanks, Lieutenant. Rebecca?
Good morning, Rebecca Heising. I work for the Cuyahoga County Board of Health. I've been there for about 25 years, been the regional public health coordinator for, I don't know, close to 20 years. So do emergency preparedness planning on the public health side.
Thank you. Hey, Bob, were you able to fix your audio? So Bob's as you see, he's the R.J. Zettenbauer square on your screen. He is our Ohio EMA field liaison. He's their supervisor for our region, and he is on the call with Michelle Sowers. So I guess, Michelle, we can just skip to you so you can kind of introduce both of yourselves, since hopefully your audio is working.
Hi, Mark. Yes, this is Michelle Sowers. So I work with Bob Zentbauer, and we cover the Northeast region for Ohio EMA. Our office is based out of Parma, but we travel throughout 18 counties throughout Northeast Ohio to, be the liaison between the county emergency management agencies and the state, and really any emergency management partner throughout the region.
Thank you, Michelle. Dave Dickens, you want to introduce yourself?
Hey, good morning, everybody. Sorry, I was switching between the phone and the computer. I was Zooming and driving, which is no good. So now I'm in my office. Good morning, everybody. I'm with Environmental Health and Safety and Emergency Management at Cleveland State University. It is really good to see everybody.
Thanks, Dave. Tom, I assume you know Rick Whitehead already. So we'll skip over him and go into Shimon.
Hi, my name is Shimon Mermelstein. I'm with Cleveland Emergency Management. I'm a planner with the city. Work under Fred.
Shimon. Leslie?
Good morning. This is Leslie White with Cuyahoga County Department of Public Safety and Justice Services, grant supervisor. I've been with the county for about 3 years. And this group likes us because we assist with getting the Homeland Security funds.
Thank you, Leslie. Larry?
Hi, you guys getting me? Can you hear me?
Yep.
Okay. So Larry Tafe with Public Safety. Leslie is my supervisor. Been here 12 years. And as Leslie indicated, you guys like us because we get your home security funds.
Thank you, Larry. Another new face in addition to Tom is Tommy Dute. Shaddy Swade, for those that aren't aware, had left the Cleveland Department of Public Health, and Tommy Dute is now filling in a lot of different areas for Shaddy. So Tommy, are you able to introduce yourself?
Yep. Hi, Tommy Dute, Cleveland Department of Public Health. Currently, emergency preparedness intern is my official title. I'm on a bridge program with the Army, so I'm transitioning out of the Army. 5 years active duty, working chemical, biological, radiological, and nuclear defense. So essentially just emergency response within the Army would be the closest title. Transitioning out of the Army, I have a cool bridge program opportunity where federal government pays the salary of whatever internship I want to take. So I'm getting my normal pay while I intern at CDPH, and am applying for this position, emergency response coordinator, for when I get out. It looks like that is likely to happen, but hopefully you won't see a different face in 3 months, but it is a possibility. So just putting that out there. But yes, hopefully I'll be back here in February full-time as the actual emergency response coordinator. But right now I am taking over that role, and currently I'm running vaccine distribution team for the city of Cleveland. So if anyone has any vaccine questions for city of Cleveland, you can always ask me. Thank you very much for the invite. Thank you for having me here today, and I look forward to working with all of you.
Thank you, Tommy. Chief Galgas?
Good morning, everybody. My name is Brian Galgas, Fire Chief over at Middleburg Fire. Apparently, I just like joining these subcommittees. I seem to be on a whole bunch of them, but really at the end of the day, I do learn a lot from people like you and what's going on, and this is sort of how I stay connected. So I really do enjoy being part of these committees. Thanks for having me.
Thank you, Chief. Heidi?
Good morning. My name is Heidi Scaife, and I'm with Cuyahoga County Board of Health, and I serve as the Emergency Planning Coordinator, and I have been with the county for just a couple of years. Thank you.
Thank you, Heidi. And Bob, I think you may have already introduced yourself, but once you again.
That's Bob Horwath. I'm a planner, Cleveland Office of Emergency Management.
Thank you very much, everybody, and good call, Mark, again about going through those introductions. It's one of those things you sort of sacrifice, not being able to meet face to face. So I'm glad you suggested that. The last transition item, as far as our membership is concerned, is if you remember Jerome Duvall. So in addition to just to recap, in addition to Ben Bellucci moving on and Shadi Swade, Jerome Duvall also moved on. He was our community sort of representative. He was the public safety director from Warrensville Heights. He has since moved on to another position outside this area. So at some point, I'd like to maybe lean on this group to help identify another potential person to fill that role. We're lucky in the sense that the Red Cross and the Cleveland Department of Public Health, roles were seamlessly filled. But the community representative, I think, was kind of an important perspective to have on this group. So at some point, I want to try to figure out who we can get to replace Jerome. With that, we can kind of go into our little agenda here. Did everybody see the minutes attached to this meeting notice?
Yep.
And with that, I will entertain a motion to approve those minutes.
So move, Fred Zabel.
Any second?
I'll second that.
I'm just going to say any opposed signify by aye, or by nay, excuse me. All right, it's hard to believe again that it was February, February, and we were at Amazon. Remember that, the fulfillment center? It seems like a million years ago.
So Mark and team, apologies. So just a point of order, Tom, you weren't at the meeting. So you really shouldn't be seconding those meeting minutes. Someone who was present to the meeting should second those meeting minutes.
Wow. Laying down the hammer. I guess
Hey,
it's a good point, Mark. Appreciate that.
It's sunshine.
As he should. As he should.
All right. Does that now mean Tom's on probation with this group?
No, you are.
Can I get a legal second for approval?
I will second. This is Kevin. I was there.
Thank you, Kevin. How dare Tom? My goodness. Okay, thank you. I don't think we have any public comment. We'll go right into our grants update from Leslie and Larry Tafe.
I actually was just texting Larry to ask if he was doing it or if I was doing it. Sorry about that. So for our FY20 application, that is due tomorrow, and actually Larry and Linda were all over that, and Larry FedExed it down on Tuesday. So that was, as I said, for our FY20 application, and then we should know hopefully early next year on if that's been approved by the state, and then at which point we can start working on specs for the different projects and getting those underway. I was just trying to pull up because I know that this group had travel for the IAEM conference that was on there, and
request.
yeah, and unfortunately we had just with the amount of money that was allocated, that project didn't make the cut. I was trying to pull up and see how far down. Which, Larry, do you know off the top of your head?
That project was in our priorities. The EM Directors Group's priorities. It was the last priority. It was the last 2 or 2.5 projects that didn't get any funding.
So Merry Christmas, Fred.
Sorry.
Well, listen, that was a Hail Mary from the beginning, so I understand.
What I would say, though, is, and I have said this, I think I had this conversation with Shimon, just to have those projects and the applications on file, so that if the funding becomes available, whether it's for this grant year or earlier grant years that are still in play, where there is money to be moved or available, that if the application is with us, that it can be potentially a project that gets funded through reallocation of funds. Again, whether it be with 20 at some point down the line, or if 19 is available through next year anyway, because the 19 grant ends at the end of next calendar year. So just to have that on record, and the same has been the case for the other couple that didn't get funded too. So.
Yeah, Larry, this is Shimon. Yeah, we're working on those IJs. Just dotting our I's, crossing our T's.
Yeah.
On that. Hopefully, should get that to you soon.
Beautiful. Thank you.
Do you or Leslie have anything else from the grants team?
No.
All right, thanks for that update. Our next item is review of updated CCESAB plans. If you recall, we use this group as a kind of a forum to vet some of our plan updates and new plan developments. So right now we don't have anything that we had asked this group to review, but I will say, and we can get into this in announcements and other business, but there has been a lot of movement within our planning world, our document world, I guess, just because we are some of you might be aware we're going through our EMAP reaccreditation, and I'll let Kevin talk a little bit more about that in the next agenda item here. But there may be some plans funneling their way to this group at some point in the near future, based off of some findings we get out of our reaccreditation process. So just be mindful of that. For announcements and other business, what I kind of plan to do is just talk very broadly about what is sort of happened between the last time we met and where things stand right now. And obviously, those that we've been working closely with, like Cuyahoga Board of Health and Cleveland Public Health and Cleveland EMA, you guys can feel free to fill in whatever I'm missing. But I just wanted to, just for the awareness of the group, obviously, again, we're in communications with mostly everybody here with regularity in other forums, but we've been activated in response to the pandemic for since physically activated in our EOC since March, and we still have a presence here, and we obviously have a distribution operation going at the County Public Works Garage for PPE. Again, most of you should be intimately familiar with all these things already, but we see now that there's we see our role continuing, what we're doing right now within the EOC and within our PPE distribution operation. Now that we have the next chapter, this is the vaccine, which we're trying to help as much as we can. The Board of Health and Cleveland Department of Public Health lead that effort. But yeah, I mean, if anybody has any questions or feels like they are sort of fuzzy on some of the areas of what we've been involved with, we can definitely talk through that right now. Brian or Kevin, from our county EMA perspective, feel free to add anything else that you think is valuable, and obviously Fred and Rebecca and Heidi. Also, I'm taking a very broad brush at this, so.
That surmises pretty well, Mark. And Tom, real quick, my apologies for such a short introduction. I was actually doing something, that's why I said something so nonsensical. Been in public safety for 15 years, did some intel with Fusion Center, did some private security stuff, a but been in planning and now operations for the last, I don't know, 6 years or so. So the EOC is obviously where we do a lot of the resource tracking, allocation, and information sharing. So basically, whatever you need to get done, we'll try to jump in and assist you wherever we can, and we'll do the same thing on our end. Other than that, Mark summarized pretty well. I mean, everybody knows we're kind of all over the board here. As of right now, we're obviously focused on the vaccine. So does anybody have any questions, or Kev have anything to add? We're full bore, so there's some light at the end of the tunnel. I'm looking forward to it.
I think the one point that I just want to add is that, you know, we've obviously, the primary partners in this, you know, as far as like the boards of health, and then, you know, EMAs, county and city have been pretty much working in tandem the entire time, which is great. So, you know, I don't think there's too much, you know, too much of a discrepancy of our experiences there. And now the same thing will happen, you know, hopefully as the vaccine rolls out. Rebecca or Heidi or Tommy, do you have anything to add about vaccine beyond just what everybody essentially knows from the news and other channels?
Hi, this is Tommy. As far as like general information, no, nothing to add. I just don't know if this is the forum to share our planning for 1A, if anyone is interested in that, and kind of the way we anticipate distributing vaccine. So if anyone would be, if that's something of interest to this group,
if you could, I think that'd be interesting. Yeah.
Okay. All right. Yep. So for phase 1A, for those who aren't aware, it requires vaccination of frontline healthcare workers, long-term care facilities, and congregate living facilities. Congregate living facilities being those facilities that deal with substance abuse programs, mental health facilities, etc. So for the city's plan moving forward, we anticipate pod operations, the points of dispensing operations, whereby we have a central location distributing vaccine to that population, and then having that population roll through that point of dispensing to receive the vaccination. For us, City of Cleveland and CDPH, we anticipate, as it stands right now, being responsible for EMS, paramedics, and airport EMTs. So those are the city employees that we anticipate fill the 1A population, with that population being approximately 1,147 individuals. Obviously, that's total population that is. We anticipate a significantly lower uptake. Right now, it seems to be approximately 50% based on surveys from the rest of the county, as well as initial surveys of the city. So our point of dispensing that we anticipate standing up will be beginning on 23 December, as all information we've received says that 22 December is the latest that we will receive the vaccine. And this vaccine being the Moderna vaccine. Has not been approved yet by FDA, but we need a point to start planning, and this is our planning process to begin 23 December. That 23 December pod operation will continue all the way till 29 December, so 6 straight days, reason being that the Fire Chief Cavillo, and Division of EMS Commissioner Carlton want to stagger their shifts as much as possible. So that's something to keep in mind when planning for vaccine administration for anyone's shifts, is that it seems that within 24 hours, there are pretty significant flu-like symptoms for a pretty large chunk of the population that's receiving the vaccine. So what the first responders are doing is they have a three-day shift changes. So they have an A shift, a B shift, a C shift on for 24 hours each day. So our planning is half of the A shift, half of the B shift, half of the C shift, and then moving on when the A shift is back on, it's the other half of A shift, the other half of B shift, the other half of C shift that'll be getting the vaccine. So at no point is any 100% of any shift receiving the vaccine, whereby they will be feeling crummy for the remainder of their shift or what have you. So that's kind of the planning process, and that's why we need 6 consecutive days for this pod operation, keeping in mind that also we require a second dose for anyone vaccinated, so that 28 days later for Moderna, 28 days later, we'll be planning the same pod operation for 6 days straight, 12-hour shifts, staffing that point of dispensing. Moving forward, we anticipate standing up pods scaling as the population scales. So as 1B population expands beyond those frontline healthcare workers to essential workers, police, corrections officers, et cetera, we anticipate standing up either more pods or for longer periods of time. And then once 1C hits, this is the difficult part. 1C, we anticipate a population of 65 and over individuals. So them having mobility issues and not necessarily being able to come to a central point of dispensing. We anticipate standing up mobile pod units. So having EMTs, paramedics going to those apartment buildings or complexes that have a large population of anyone 65 and over to vaccinate those individuals and those populations where they live, kind of easing the process and making sure we have as much uptake as possible. And then moving on to general population, again, points of dispensing, we anticipate no less than 6 points of dispensing at any given day. And we're working on the staffing for those 6 points of dispensing, relying on EMTs, paramedics, and nurse volunteers to administer the vaccine, and then relying on city department employees as well as volunteers to staff the remainder of the point of dispensing. But that's where we stand on our planning. Very, very high level summary, but that's where we stand on planning overall, as well as phase 1A in particular. I can obviously talk much longer on this because there are so many moving pieces, but if anyone has any questions right now, they can ask me now, or if anyone has any questions about any future plans, obviously you can feel free to email me at any point. But pending any questions, that's all I have.
Tommy Matacoca, when do you anticipate your 1B rollout?
So we don't have enough information on when we anticipate 1B just yet, because that's really determined by the state from our understanding. Because as I understand it, and this is potentially coming out in the vaccine call tomorrow, there's a vaccine planning meeting tomorrow. As I understand it, the state is determining when we are allowed to administer to the 1B population. So if we go through our entire 1A population in the city of Cleveland, as far as I'm aware, we still aren't allowed to move on to 1B until we get permission from the state with the remaining vaccine that we have. So not entirely sure how that's going to work from timeline perspective. If I was to make a general bet, I would say, and again, this is entirely a bet just based on information that we have right now and information that's being shared at the federal level. My guess would be that 1B would be approximately end of January, early February, but maybe Rebecca and Heidi have different information, but that would be my general bet on when we can anticipate 1B beginning.
Thank you. That's probably fair. So from the healthcare perspective, we are on day 2 of our VPOD, our vaccine point of dispensing. So 10 Ohio hospitals received 975 doses. So that's the language, not vials, but doses of the Pfizer vaccine. We opened up and started distributing yesterday in Northeast Ohio's Cleveland Clinic, Metro Health, and then Altman Hospital in the Canton area. We anticipate next week that we will receive 2,700 doses of Moderna, and we'll start executing on that. So, Tommy, if you I'll share any lessons learned from our vaccine pod, but it's been going pretty well. No untoward reactions. You'll hear stories of 3 thus far, 2 in Great Britain and 1 in Alaska. These are folks that have had allergic reactions before, at least in England. The one in Alaska did not. Epinephrine was the countermeasure to that, and that was effective. One person was admitted for observation. By open source reports, they're all doing well. So for the state-wise, so you guys know, for nursing homes and other congregate living, that's Walgreens and CVS. At the federal level, they receive the lion's share of allocation. 60% of what was purchased by the federal government was allocated to those 2 private sector retail pharmacies. I don't have any direct insight into their planning considerations, but I think they'll have some challenges to accomplish that. At some point in time, when there's a good vaccine stream across this country, I anticipate, at least in the healthcare sector, we would probably diffuse pods and maybe use kind of routine clinic appointments and those sorts of things to augment points of dispensing. I would anticipate, if there's good, not too much vaccine hesitancy, that by July, if we get a good 60 to 70% folks accepting the vaccine, then we would have achieved vaccine immunity, which is different than herd immunity. So if we waited for herd immunity, it would take us about 100 years, because only 2% have been tested positive. So vaccine's the way to go. Hope is here.
Brian, and this is Brian Galgis from one of the fire departments. Just a general question about vaccines. When we're talking 1A and we're talking about healthcare workers, are we also considering the essential people in our departments that maybe aren't healthcare workers, like administrative assistants?
So that's a great question. So our approach is, if you work, at least in Metro Health, if you have a Metro Health badge, you're a healthcare worker. But we're doing risk stratification. So we've inoculated our police force that have direct patient contact, our emergency departments, our ICUs, and those front facing folks. Myself, I'm COVID-free in my office. I go to the VPOD, so I'm eligible, but I'm not high on the list, nor do I want to be high on the list. I would absolutely give that to someone else who's there. The other thing that we're going to partner with Cuyahoga County is really identifying high-risk populations. So that is generally determined by social determinants of health and those sorts of things that have a higher incidence and impact to vaccines. So, folks, I guess a question, Chief, would be when I was running this through with our pharmacists, they wanted, well, our pharmacy tech should be getting this. And I go, your pharmacy techs don't necessarily go into patient rooms. They're on a floor in a secured med room. So their risk is not zero, but it certainly is not high. So when we get a good supply of vaccine, those triage decisions will be less important, because whoever wants it would be able to take it.
Thank you.
Did that help? Did that help, Chief? Okay.
Thank you, Mark and Tommy. Rebecca and Heidi, do you have anything to add from the County Board of Health perspective on this?
Sorry, Mark. You know what? I am picking up on the context of this discussion. I had to step away for a few minutes, so
yeah,
I'll defer to Heidi maybe.
The bottom line, Rebecca, is we've given you a lot of tasking, and we appreciate that you're going to get that done before Christmas.
Thank you.
And thank you for taking the minutes for this meeting.
Great.
Rebecca, the question was if like an administrative assistant at a fire station, would they be in the initial 1A or 1B tier? Chief, I don't want to speak for Board of Health, but based on the initial tiers, it's going to be EMS to start with. Based on the initial vaccine dose, 4,000 is what the county is supposedly receiving on the 22nd. We have 7,000 first responders in the county. So we're initially going to roll it out, and I don't want to speak for Board of Health. Rebecca can chime in accordingly. We'll start with those 1A. That'll be direct EMS personnel. Okay, there's my daughter, everybody. You can say hi. School starts in 3 minutes, and I'll get her logged in here too. Thank you. So
bring an apple to your teacher who's your father.
It's going really well.
Rebecca, I can give just a brief update. Tommy covered a lot of the information, so I'll just keep it real brief on kind of what we're planning. So we are planning, of course, for phase 1A, and that will be EMS. And from there, we'll expand to other priority groups within phase 1A. So right now, internally, we're trying to determine gaps, like possible, we might go to long-term care facilities that didn't sign up for as providers or part of the pharmacy program. And we still need to, been some guidance coming out from other health departments on how to prioritize the 1A groups from EMS. EMS, of course, is our priority. So that's something that we have been, are still working on. But we do have EMS pods scheduled. And if the Moderna vaccine gets in on time and EUA is approved and we get the ACIP guidance, we pretty much are planning to begin on the 28th. And that those will run from 1 to 6 p.m. So from the 28th through the 30th, we're focusing on EMS. So I don't know, Rebecca, did you want to add anything else? Tommy really did a good overview of everything.
Yeah.
So
Tommy stole all your thunder for sure.
No, that's good. Thank you, everybody. Teamwork.
All right, thank you for that. Any other aspects of the response or vaccine that anybody wants to talk about?
So again, with this hope of vaccine, I think it's important for us as leaders amongst our teams and really with everyone. We do have many months to go. We're not quite through it, but we've started that sort of journey. So again, everyone, Americans aren't necessarily patient. So we like an instant on and, everything solved in a 30-minute TV show. So then there's reality.
Yeah. Any other non-related vaccine or response items to COVID that someone wants to discuss as part of this? And I would like to just, Kevin, if you wouldn't mind, just kind of giving a brief synopsis on our EMAP process for the awareness of the group.
Sure. So we had our virtual on-site assessment for our EMAP reaccreditation for 4 weeks, end of October through end of November. We are still waiting for the final exit briefing for the official results, but it looks like we'll have a few findings that we'll need to correct and address over the next month once that briefing happens. Nothing major, just some improvements that will make our program even better. And we're anticipating getting reaccreditation next year. So, but the overall process was we loaded all of our documentation into an online drive that they could view and access. And they reviewed all of our documents and came back with some praise for multiple documents that we had and multiple practices that we had, as well as some improvements. So looking forward to the exit briefing to identify our actual findings versus the preliminary results that we got each week. So.
Thank you, Kevin. Does anybody else have any other items they want to discuss? I know a number of us are up against another fire chiefs meeting that's going to start pretty soon here. So if nobody else has any other items to discuss, I just want to, before we adjourn, I just want to thank everybody again for making time to wedge this this last meeting into 2020. I'm glad we were able to do it. It's good to see all your faces and hear all your voices. Next year, you know, it's going to be dynamic still, but I'll make it a point to try to put out a tentative schedule of meetings for this group, just so we can try to plan around that as best we can. And yeah, and thank you again to Tom and Tommy for joining us today. I'm glad you're able to be part of this group, and hopefully we'll continue to be so for the foreseeable future. Any other final items?
Mark, can you update the roster with contact information to share for everybody?
Absolutely.
And aside from that, happy holidays, be well. Eat your vegetables.
All right, with that, I'll entertain a motion to adjourn from somebody that's not Tom.
Motion to adjourn, sir. Claus.
Second, Kevin.
All right, thank you all very much. Motion carries. Happy holidays, everybody. We'll talk to you soon. Take care.
Happy holidays.
Bye, guys.
Bye, everybody.
Bye-bye.
Bye-bye.
Bye. Merry Christmas.
Thanks, Mark.